I am Paolo Vinciguerra. I am working in Milano at the Humanitas Institute, Eye Center. This is a private university, and we have a large group working with me. I prefer to use the Schwind Amaris in a customized treatment because one size does not fit all. So every cornea is completely different from the other. So if we pretend to apply the same shape to every cornea, we have good outcome for lucky, not in a repeatable way. But we can not only in customized treatment make the correction, but make the cornea even more regular with less eye-order aberration. Then usually, when you do customized treatment, the resulting optical zone is wider for the same input in the optical zone, so it's much more convenient. The cornea is treated customized because we want to reach the best possible visual acuity for the patient. So if we try to apply a standard treatment to everyone, many corneas are somehow asymmetrical, so the resulting outcome will be even more asymmetrical, and that means halos and night disturbance. If we customize, we do not only correct the refractive error, but we improve the experience even before of the surgery, disturbance or halos or night driving disturbance. So it's much better for the patient point of view, and the healing process is more predictable because customized we reduce the corneal curvature gradient. That means more stability and more predictability. The epithelium is a masking agent that is layered over the cornea, not in even way. Even in a normal cornea we have 55 in the center and usually 65 in the periphery. Those asymmetries been measured before and treated, taking account the shape with the epithelium. But if you remove the epithelium, then the shape you are aiming to treat is completely different from the real shape. So the outcome becomes unpredictable if you do not do transepithelium. Centration is becoming a growing issue in refractive surgery. What we did in the past was very primitive, or not tracking or tracking the pupil center. But the visual axis is not in the center of the pupil. So if you track the center of the pupil, you end up always in the center treatment. The center treatment means coma. Coma means double vision and night halos. In addition to this, the eye order aberration is measured by the center of the pupil. Schwind now is able to track for the low order the visual axis, for the high order the center of the pupil, and that means the perfect solution because we aim exactly where is needed. If you look at standard treatment topography, you always have a red moon-shaped in the inferior temporal area because or the pupil usually in the visual axis is displayed as superior and nasally. So the treatment is completely displaced. If you do not take in consideration this with custom and the two different settings in this centration, your treatment will be never be perfect, and the patient will perceive it halos even after custom ablation. Stability is a very important issue because if you correct the patient and after months becoming myopic or hyperopic or astigmatic, the patient is not happy. Even promising a free retreatment is not satisfying for the patient. So aim should be to get in the target in the first treatment. And that is a good start because that means, first of all, that you have no need of high normogram adjustment in your treatment. The second is that the patient is get immediately the target. He do not have to wait months to be in the target. And the third, the stability over time and the constant of the power of the cornea in different pupil size. So that means that you do not perceive different quality between night and day. The aim of Schwind is creating a post-operative cornea after a custom treatment that is similar to physiology. That's why the patient is so satisfied. It's very difficult from a doctor without having the pachymetry to understand that this is treatment, because in the life a doctor sees people who has a cornea ranging of 38, 39, normal, untreated eyes, and other who has 48. So we have to transform corneas in a physiological way to be stable, good quality, and insensitive to pupil size. I was very happy to have the Schwind Amaris 1050 now, because the relationship with the company, this is a beautiful team that interact with us very quickly. So when is good opportunity to improve the system, they react immediately. The assistance is very nice. So everything is what everyone wishes to get from the company. Good outcome and a company who reacts very quickly and well.